And welcome to the second session. My name is Judy Cohen, and I'm the current president of the International Dyslexia Association, Florida branch. On behalf of our entire board, I want to welcome you to this webinar and thank you for taking time from your Saturday to join us. I also want to remind you that these webinars will be presented on the second Saturday of each month through November. Our next session will be June 12th, and it will feature Dr. Jan Wasowich, a well-known speech-language pathologist, founder of Learning by Design, and moderator of Spell Talk, a professional listserv. Please mark your calendars and plan to join us. Before we get started, a few housekeeping notes. Everyone is muted, but feel free to use the Q&A tool throughout the session. We will attempt to answer as many questions as possible. This session is being recorded and resource documents will be available on our website, fl.dyslexiaida.org. Today's session is Best Practices in Assessment and Identification of Dyslexia. The presenters are Dr. Colleen Crooms and Mr. Jesse Steiff, two of our very own IDA Florida Board branch members. Colleen completed her doctoral degree in school psychology from Oklahoma State University. She also holds a master's degree in educational psychology, school psychometrics. She has worked in private practice settings for the last 6 years in North Florida, South Georgia, before she relocated to Clearwater. As a private practice psychologist, Colleen specializes in the evaluation of neurodevelopmental disorders. These include intellectual disabilities, learning disorders, attention disorders, and autism spectrum disorders. Colleen is passionate about the assessment process, as well as differentiating diagnoses in order to guide the most appropriate treatment. While at Oklahoma State University, she was member on several research teams to advance the knowledge on academic and behavioral interventions in the classroom. In addition to providing comprehensive evaluations, Colleen provides empirically supported treatment, school consultation, and/or service coordination. Jesse Steiff works in both private practice and public schools in the Tampa Bay area. He has dedicated his career to working with families and children with dyslexia and other learning differences. He is an active member of the National Association of School Psychologists and the International Dyslexia Association. His areas of expertise include assessment and remediation of dyslexia and other specific learning disorders, attention deficit, hyperactivity disorder, autism spectrum disorder, intellectual disabilities, and other conditions that may affect an individual's ability to learn. He has presented numerous workshops for parents, teachers, and administrators on topics including phonological awareness assessment and intervention, the simple view of reading as an instructional framework, anxiety and attention difficulties in children with dyslexia, and navigating the response to intervention process for parents. And Jesse is the president of the newly formed Florida chapter of the Reading League. So, with no further ado, I'd like to hand it over to Colleen and Jesse.
Thank you, Judy.
Judy.
Hi, good morning, everybody. I'm Dr. Colleen Crooms, and I'm going to be presenting with Jesse.
Right, and I'm Jesse Steiff, and so let's kind of launch right into it here with our agenda. Dr. Crooms will bring us through the agenda, and then the first portion of the presentation, and then we'll kind of switch it around and talk about the different slides.
Yes, so for our agenda today, and as Judy mentioned, as we go through, if you guys have any questions, please feel free to use the chat box, and we'll be monitoring that throughout this presentation. And that way we don't have to have everybody wait till the very end to answer questions. So as you guys think of stuff, please, and we'll also be asking you questions. So if you would like to participate, use that chat box. Okay, so for the agenda, we're going to start with background information. We're going to discuss the prevalence and a little bit about dyslexia and the different definitions. Then we're going to go right into the purposes and types of assessments. We're going to talk a little bit about dyslexia in the public schools, and then go into a little bit more in-depth kind of evaluation of the difference between a specific learning disorder versus a specific learning disability. So kind of comparing and contrasting public schools versus private schools and those evaluation processes. And then we'll also be going into depth on the components of a dyslexia evaluation, as well as comorbid diagnoses. So of our participants, what topic are you guys most excited or most looking forward to learning about today? Or maybe if you already have a experience, just what you're looking forward to listening to about.
Feel free to pop it in the chat there.
All right. So I wanted to include the International Dyslexia Association's definition of dyslexia, just because, again, this is an IDA presentation. With dyslexia, they categorize it as a specific learning disability that is neurobiological in origin. So it's characterized by difficulties with accurate and fluent word recognition and by poor spelling and decoding. So that is, something that's very similar, to our diagnostic manual by the APA or DSM. These difficulties typically result from a deficit in the phonological component of language and is often unexpected in relation to other cognitive abilities and the provision of effective classroom instruction. So again, some rule out stuff in there. So secondary consequences may include problems in reading comprehension, reduced reading experience that can impede growth of vocabulary and background knowledge. And we will, as we go through the components of the evaluation, kind of hit at all these different areas. So talking about like the prevalence of dyslexia, when we speak about prevalence, I always like take it with a grain of salt, just because we know that sometimes things can be overdiagnosed, underdiagnosed, and misreported in some way. It is the most common of all the neurocognitive disorders. So one of the statistics that I found represented 80 to 90% of all those with learning disorders. I also had a current report that indicated 1/2 of all students who qualify for special education are classified as having a learning disability. So that's also, fairly important. So dyslexia is the most common of all the reading difficulties. And so one study by the National Institute of Health found that 1 in 10 dyslexics will qualify for an IEP in special education out of all the kids that are potentially having some difficulties. So we have something. Is it possible for you to share the slides with us, the listeners, so we can download and print them? I believe we can. I can forward that. I have my screen shared, so I'll try and do it on my other screen once Jessie takes over. Okay, so I will get that to you guys. Going through and talking about just the differences. I know we have a lot of school psychs on here. Yay. Yay for us, guys. But when we talk about school and we talk about specific learning disability, I know there's a lot of back and forth on the terminology, because the DSM uses specific learning disorder versus specific learning disability, and there can be a little bit of confusion. So schools, and this is straight from the Florida DOE website, specific learning disability is defined as a disorder with one or more of the basic learning processes involved in learning or in using language, spoken or written. You'll hear us talk a lot about that. Spoken or written is going to be a common theme throughout, that may manifest in significant difficulties affecting the ability to listen, speak, read, write, spell, or do mathematics. Associated conditions may include, but are not limited to, dyslexia, dyscalculia, dysgraphia, or developmental aphasia. So, specific learning disability does not include learning problems that are primarily a result of visual, hearing, motor, intellectual, or emotional behavioral disability, limited English proficiency, or environmental, cultural, or economic factors. So again, we're going to hit a little bit more on those rule outs as we talk more about the components. So that was a learning disability. Our DSM from the American Psychological Association defines a specific learning disorder with impairment of reading as difficulties learning using academic skills, as indicated by one of the following. So we have the difficulty with reading, inaccurate, slow, lots of effort being given, difficulty understanding the meaning of what is read, difficulty spelling. So you could see some of the similarities with written expression, with understanding number concepts, number facts, difficulty with mathematical reasoning. There are a lot of similarities, but one of the things that we know is that if a child does qualify under a DSM-5 diagnosis of a learning disorder, does not mean that they will qualify under a specific learning disability in the school setting. The affected academic skills are substantially and quantifiably below those expected for an individual or chronological age. The learning difficulties begin during school age years. They may not fully manifest until later. It depends on the individual's presentation. The learning difficulties are not better accounted for by, and here are some rollouts here, the intellectual disabilities, uncorrected visual auditory acuity, other mental or neurological disorders, psychosocial adversity, lack of proficiency in language, academic instruction, or an inadequate educational structure. So they both have those clauses that, have those exceptionalities. With the DSM-5, dyslexia is an alternative term used to refer to the pattern of learning difficulties characterized by problems with accurate or fluid word recognition, poor decoding, and poor spelling. Now, the DSM still allows us to use, alternative methods for identifying, a specific learning disability with reading impairment. And so because of that, again, I want to reiterate that just because, when we're going to talk about the difference between private versus public, if a child qualifies under like a diagnosis of the DSM, does not automatically mean that they'll qualify under the specific learning disability criteria for our exceptional student education. So, again, very important to distinguish those two. We're going to go into early signs, and I'm just still trying to multitask a little bit. So some early signs for preschool students. So delay in learning to talk, difficulty with rhyming, difficulty pronouncing words, poor auditory memory for nursery rhymes and chants, difficulty in adding new vocabulary words. So you could see a lot of that can overlap with some other, delays in speech or speech and language communication difficulties. But again, these are some of the pre-warning signs. Hey, what should we keep an eye on? In kindergarten and first grade, this is where we start to see difficulty breaking words into smaller parts. So we have difficulty identifying, manipulating sounds, difficulty remembering the names of letters or recalling their corresponding sounds, difficulty decoding single words, difficulty spelling. So you could see a lot of those sounds, blends, codings, manipulation, those are all really, really important. And when we see kids in those early years start to develop a gap in those areas, that's something that's, hey, warning, red flag, let's ring the alarm. Then we have 2nd through 12, because remember, it can manifest later. So you can have a child in elementary, middle, even high school with very slow acquiring reading skills. Their reading is very slow, not fluent, can be awkward. Then they're going to obviously struggle with some comprehension. They confuse words that sound alike. They have trouble reading unfamiliar words, often, kind of you've seen kids make those wild guesses. Sometimes it doesn't change the meaning. Sometimes it definitely will change the meaning of the passage that they're working on. They avoid reading out loud. This is one of the biggest things that I see in some of my own private evaluations. Is I have kids that get super anxious about reading out loud. They display spelling difficulties, and they've developed some skills, but they still require a lot of effort, and they work at a slower pace. So again, one of those red flags is that, oh, my child, they're spending so much time trying to kind of get these or master or finish these tasks. And this was one with me, is rarely reads for pleasure and suffers extreme fatigue when reading. So those are all pretty important early warning signs. And I'm going to go ahead and hand it over to Jesse, and I will get those slides over to be shared. Okay, so Jesse, you're on.
Oh, I just committed the cardinal Zoom sin of starting to talk when you're on mute. So sorry, it doesn't matter. I'll never ever get used to that. Okay, so when we talk about dyslexia identification, it sort of calls up the mental picture of a child sitting with a clinician and going through a battery of diagnostic tests, right? But there are several other types of assessments that schools and tutors are engaging in that can help narrow down these larger pools of students to smaller groups of students who would be suspected of having dyslexia, and to help target instruction for those students and monitor their progress through a course of intervention and treatment. So larger frameworks of dyslexia identification, like systems of dyslexia identification, say in a class or a school district, would start with screenings. So, screening tests are these brief measures of key skills that can indicate how likely a student is to go on to fail an outcome measure. so screening measures tell you roughly whether or not a student is in trouble and needs intervention, but they're not sufficient to diagnose or to classify a disability like dyslexia. Screenings can and should be done as early as kindergarten for these key skills that are associated with reading, like phonological awareness and letter sound knowledge and rapid automatized naming and oral oral vocabulary or non-phonological spoken language skills like reading comprehension, or I'm sorry, listening comprehension. Screenings can also be helpful. It can also be helpful to ask a parent about a family history of reading difficulties as part of a screening procedure. But we do want to be really careful to note here that just because there are no family history of reading problems doesn't mean that the student can't be at risk or that they have dyslexia. So we just want to note, and I just want to note here also about the last note about a screening procedure. It's really important to be aware of the properties of your screening measures if you are a staff member of a public school district, because the conclusions that you draw from them in terms of their will be varied depending on the screening's reliability and validity. So we just have to be really careful there. So then there's progress monitoring, which are regular sort of temperature checks can we go back to that and one more? There we go. There's progress monitoring, which are these regular like temperature checks that teachers and tutors and schools should be using to determine whether or not a student is making progress when receiving strong intervention. So screening and progress monitoring, they can both use similar types of assessments, usually in the form of curriculum-based measures or CBMs like oral reading fluency, nonsense word reading fluency, phoneme segmentation fluency. So there are several publishers that make these freely available online, like Dibbles and Acadians and Easy CBM. Many school districts will also use computer adaptive assessments like iReady or iStation, STAR, FastBridge as their progress monitoring tools. And dyslexia and other specific learning disorders, as defined by IDEA, they're characterized by their intractability in the face of intensive intervention. So in other words, a student with dyslexia responds more slowly to intensive instruction, and progress monitoring assessments are key to understanding the dyslexic student's response to intervention, right? And so dyslexia identification partially lives in the length of time it takes a student to respond to intervention. Response to intervention is a really large part of how school districts in Florida identify specific learning disabilities like dyslexia. Okay, so next let's talk about diagnostic measures, are kind of what we think of when we think of your classic, sit down with the psychologist and let's see what's going on, battery of assessments. So these are typically individually administered assessments of skill that can be used at various points in the intervention framework. Right, so curriculum-based diagnostic assessments that are administered by a teacher are helpful after students have been screened and we need more information to drive their instruction. So maybe we've done an oral reading fluency screening assessment for a student and we found that they're at risk, and then a teacher can come in and do a curriculum-based decoding survey or a phonological awareness assessment. Someone in the chat mentioned the PAST, the phonological awareness screening assessment. That would be a great diagnostic measure, and to see if what skills are contributing to the problem and what requires instruction. There are also other classes of diagnostic assessments, your norm referenced diagnostic assessments that are used as comprehensive evaluations for disabilities, where Dr. Crooms or I would sit down with a student and administer a battery of these diagnostic assessments to figure out where the student is functioning and the magnitude of the problem relative to other children. And then there are outcome measures, and these are your broad end of unit or end of year assessments that we use to determine if a student is meeting age or grade level standards. We all know the FSA here in Florida. That's an outcome measure. And I do want to note, though, that just because you fail the FSA or another broad outcome measure doesn't necessarily mean that you have dyslexia. And conversely, there are many students with dyslexia who do pass the FSA. And the reasons for those things are many and varied, and maybe not necessarily within the scope of this presentation, but we are always happy to have conversation with folks about why those things happen, maybe after the presentation. So when evaluating a student with dyslexia, I want to know about each of these levels of data for a student. You know, have they been flagged by the school's screening system? Are they in supplemental or intensive interventions? And is their progress being monitored closely in the right skill with the right type of progress monitoring tool? How are they doing on these broad outcome measures? These are all questions that I want to answer as an evaluator of dyslexia. So to boil it down on our next slide, you know, the different types of assessments can answer different types of questions as they relate to dyslexia identification. If you want to know which of your students are at risk for reading failure or at risk for developing or worsening dyslexia and they need intervention, then you need a strong screening protocol. If you want to know how your students are responding to interventions and how intractable their reading difficulties are in the face of intervention, you need a good progress monitoring protocol. Dyslexia is at its most basic and stripped down level, a difficulty with basic reading skill that is resistant to instruction or intervention, right? And that resistant to intervention piece is best answered with good progress monitoring data. And finally, you know, diagnostic assessment is kind of where the rubber meets the road for a comprehensive dyslexia identification, right? So it answers the questions, you know, of, you know, what are the students' individual strengths and weaknesses as they relate to reading, and what is the magnitude or what is the size of the problem, right? So when I say magnitude, I mean, you know, where are the reading skills falling? Are they at the 30th percentile, at the 15th percentile, at the 2nd percentile? These are things that we want to know. All right, so one of the big questions here, can public schools say dyslexia? Can they say that a child has dyslexia? Absolutely. They can in certain scenarios. This is like one of the biggest misconceptions out there among schools, and one that I'm sure many people here are familiar with. Dyslexia is specifically listed in IDEA, our national, you know, one of our big national disability education legislation, and in Florida state regulations as one of several specific learning disabilities, right? So schools can certainly identify a child as having a specific learning disability. And then if their specific learning disability is in basic reading skills, they can refer to that child as having, or that student as having dyslexia in their IEP and in the educational record. So dyslexia is not like a medical diagnosis that only doctors or licensed psychologists can diagnose. We get tripped up a lot with that term neurodevelopmental or neurobiological. Like anything to do with learning, you know, dyslexia is brain-based and neurobiological in origin, but this doesn't mean that it's a medical condition like solely in the purview of private practitioners. You know, identification and treatment of dyslexia and other learning disabilities, it falls in the educational realm because dyslexia is a learning disability, and teachers and educators are the experts in teaching students to read and spell. There is no primary classification of dyslexia in special education legislation. The umbrella term is specific learning disability, and there are several types of specific learning disabilities. All right. So there are no legal reasons to avoid using the term. So someone in the chat said, I was told by my principal not to say it. That is very disappointing. That's very disappointing to hear, and I'm sure that a lot of people in positions of public education would disagree. In fact, there's a document from the Office of Special Education and Related Services, OSERS, from 2015, indicating that nothing prevents schools from using the term dyslexia in evaluations, in eligibility determinations, or on IEPs. The term SLD, though, it must be used when discussing like eligibility classifications, because again, there's no dyslexia classification, but it's certainly permissible to use dyslexia specifically and say that a child is dyslexic on an IEP, you know, in this way. For example, John has dyslexia, a specific learning disability in the area of basic reading skills. More specifically, he struggles with accurate word decoding and spelling. That can easily fit in an IEP and present levels of performance if people are familiar with the different sections of the IEP. And so, oh yeah, I see, yep, Sue, thank you for posting that in the chat. That's exactly what I was talking about. So we have, and we also at the bottom of this slide have a nice link to a National Center on Learning Disabilities document that provides really solid and clear Q&A, question and answers on what is and isn't permissible in the public schools. And this link is also found on the Florida Department of Education's website. All right, and the next one. So while public schools can and should certainly evaluate and identify students as having a specific learning disability, specifically dyslexia, teachers alone wouldn't be making that sort of determination. I know we have mostly teachers and other instructional folks here on the call. Disability determinations in public schools are made as a team, and the evaluation is conducted by several school staff. So in Florida, you know, a large determining factor of a student's eligibility for services under the specific learning disability program, and by extension, your ability to say dyslexia, a large factor is their response to intervention. And teachers are the ones providing the instruction and monitoring the student's progress. And they are, in most situations, the most well situated to recognize warning signs of dyslexia and to provide intervention to the student and to serve as part of the team that makes that disability determination. So we can't be the sole determiners of the presence or absence of dyslexia, but teachers are an absolutely integral part of dyslexia identification. So just as sort of a summary, and because we thought this was a nice little graphic, conditions like dyslexia and dysgraphia and dyscalculia, they're all different types of specific learning disabilities that fall under that broad umbrella term. So with specific learning disabilities in reading, dyslexia is one of the types. And the other type of specific reading disability is specific comprehension disorder, in which decoding and fluency may be appropriate for age and grade, but comprehension is still significantly impaired, which usually kind of co-occurs with some type of spoken language impairment. But we just kind of like this, this graphic to show that dyslexia is one of the many types of learning disabilities. Okay, so a student is now sitting in front of Dr. Crooms or a psychologist or another clinician. So then the question is, what does a good dyslexia evaluation include? So it might be more accurate to ask what a good reading evaluation would include, because good dyslexia evaluations will paint a picture of all of the reading and language and other skills that have some bearing on an individual's ability to read. And we want to note here that, I'm still on the previous slide. We want to note here that we'll be referencing some specific test instruments that are norm referenced, individually administered assessments of skill that a psychologist or other professional with graduate level training and test administration might administer. So if you're a teacher, a parent, or another professional, then definitely still stay tuned, because we're also going to be going over some fantastic criterion referenced curriculum-based measures of these same key reading skills that all teachers can administer. All right, so the first component, the start of a good evaluation, should be taking a thorough history of the student. We'll want to know about medical factors that could possibly be affecting a student's learning, including like early or current vision and hearing difficulties. To talk about hearing for a second, hearing difficulties can and absolutely will affect phonological awareness, a key predictor of reading. And we often see things like early ear infections, tubes being placed in the ears, traveling together with other indicators of language difficulties like speech articulation problems, and early literacy difficulties with rhyming and letter identification. These things all kind of tend to travel together. You'll want to note if there are any family histories of mental health or learning difficulties. Much of the time you won't have like family members with diagnosed learning disabilities, but it'll manifest more as, well, my uncle didn't graduate from high school, or my cousin really hates to read, or my sister only listens to audiobooks, and other sort of qualitative indicators of family history. You'll want to know about early developmental milestones, particularly early speech and language and fine and gross motor skills. Many kiddos with reading difficulties or dyslexia, they have or had developmental delays in these areas. Although I do want to note that students can still certainly have dyslexia, even if none of these early developmental milestones were late in their development. We always want to assess for emotional or psychological concerns. Reading difficulties and anxiety have a super high co-occurrence with one another, as Dr. Crooms will talk about later. Reading problems and attention problems are also highly comorbid, so much so that I would argue that we shouldn't do an isolated reading evaluation without at least brief, if even informal, evaluation of these sort of comorbid factors like attention and executive functioning difficulties. And finally, an educational history, I think, is the most important aspect of taking a history. As a clinician, one of the first questions I have is, what are the interventions, or what is the school doing for the student prior to this evaluation? The lens through which I view a student's test results can be different depending on a lot of things, but a big one is whether or not there's been any effort to remediate a student, using like an evidence-based program of instruction, because it can be really difficult to tell the difference between a student who's struggling in reading simply because they haven't gotten great instruction versus a student with dyslexia. So it's really important to know what efforts have been made to remediate a student prior to the diagnostic evaluation. So getting into the content of the evaluation, and it is really hard to talk and then monitor the chat at the same time. So I apologize if people are talking here. One of the first things that I want to know about are multiple aspects of phonological processing, beginning with phonological awareness. I'd want to know specifically about how a student is able to segment and blend and manipulate these various phonological units like syllables and onset rhymes and phonemes, with phonemes kind of being far and away the most important phonological unit to reading. There is an instructional hierarchy of complexity to phonemic awareness that assessments will follow. That begins with awareness of the first phoneme, which kind of overlaps with onset rhyme awareness, then awareness of the last phoneme, then the internal phoneme in a CVC word, and then awareness of internal phonemes within consonant blends, like the ul in blue or the n in scent. Many kids with dyslexia have difficulty with registering those phonemes, which cause problems in spelling and decoding. Phonological awareness difficulties not only affect students' ability to decode and spell words accurately, but they also really throw a wrench in this mental process by which words are stored in memory for automatic retrieval when reading and spelling. The process is called orthographic mapping. And if that's not a phrase in your vocabulary, I definitely highly recommend that you read about it, and specifically the work of Dr. Linnea Airy and Dr. David Kilpatrick, who has popularized the work of Dr. Airy. I also want to know about rapid automatized naming. And this refers to kind of the speed and ease with which a student can reach into their mental filing cabinet, as it were, and fluently retrieve specific types of information. RAN, for short, RAN has been shown to be a unique contributor of variance to reading performance. So it's like a real thing that we want to know about. And we'd measure this by having the student look at, a page of objects or colors, sometimes letters or numbers, though that can be problematic with younger kids who don't know their letters and numbers, and have them rattle off the names of them as quickly as they can and compare the speed that they were able to do it with that of other children their same age. So students with low rapid automatized naming tend to be much slower, more labored readers, even if their accuracy has largely been remediated, actually. I also want to note here that everyone should be wary of any program that purports to train rapid automatized naming. It's generally not something that you can specifically tutor a student in with great effect. But there is plenty of evidence to suggest that rapid automatized naming improves as general reading skill improves. So on to phonological working memory, which is another key aspect of phonological processing. So it refers to like your ability to keep information in your immediate awareness, to analyze that information while blocking out competing stimuli and staying focused, and then using that information. And it's just super important to so many aspects of reading. Your working memory is really like the canvas on which reading takes place. And working memory difficulties can cause really serious problems, particularly with decoding and spelling, but also with comprehension. I've seen kids who are kind of at an earlier phase of word reading and are kind of reading letter by letter. And by the time they get to the end of a word, they've actually forgotten some of the first few sounds. So that decoding process is just really thrown for a loop because they can't hold, 4 or 5 phonemes in their head at one time. The hope is that as kids become more fluent and that they're able to decode more by larger and larger sequences of letters, like the cognitive load on their working memory is eased a bit, and they can dedicate more of those super precious working memory resources to comprehension and not decoding. But the way that we measure these things is by, ticking off a list of numbers, for example, and having the student repeat them back verbatim or backwards or in numerical order. There's also these non-word repetition tasks where I'll say a nonsense word of like increasing length and complexity, and the student has to repeat them back verbatim. So we've kind of listed some test batteries here that include various aspects of phonological processing. Definitely want to note here that this is not an exhaustive list by any means, nor do all these assessments measure phonological processing in the same way, which would certainly have implications for how you interpret the results. For my money, and my Jesse Steiff's personal opinion, not the opinion of any other organization, you can't beat the CTOP, the Comprehensive Test of Phonological Processing. It's created by Dr. Joe Torgeson, who is a former head of the Florida Center for Reading Research. And he's like, if there was a Mount Rushmore of reading researchers, he would be on it. And the CTOP has multiple subtests for each of these 3 skills, like separate subtests for blending, segmenting, phoneme isolation and deletion, and it's a pretty quick assessment to give as well. Like something like the KTEA, the Kaufman Test of Educational Achievement, on the other hand, has a phonological processing subtest, but it condenses blending, segmenting, rhyming, sound matching, and phoneme and phonological deletion all into one subtest. In a way that can confound multiple different skills. The KTA does, though, have a rapid automatized naming subtest called Object Naming Fluency, which is very good. But you'd have to look elsewhere for a phonological working memory assessment, which is, again, why I like the CTOP, because it includes all of those in the same area. All right. Next slide here. So a good dyslexia evaluation will bring an examinee through reading single words, real words and nonsense words under both timed and untimed conditions. So timed and untimed real word reading entails two sort of overlapping suites of skills. On an untimed real word reading test, an examinee can answer correctly in 3 different ways, actually, each of which have a different implication for that child's reading skill or that individual's reading skill. They can automatically recognize the word without having to decode it. This is like the hope for most words in skilled readers, right? They can decode the word or sound it out, or they can read by what's called set for variability. Set for variability is just a fancy term for when a student tries to decode a word and gets to like a phonetic approximation of the word and then says the word correctly based on their knowledge of vocabulary. So for example, if a student is reading the word chair and says ch, a, I, chair, that student would actually get that question right on an assessment of untimed real word reading, but that doesn't mean that they're like solidly decoding that word, right? They'd still need some help with vowel teams for sure. You know, and kids with very good spoken vocabularies, but poor decoding skills can still sometimes trick an untimed test of real word reading and actually do relatively well based on this set for variability. So I actually put not a whole lot, I mean, I still put some diagnostic emphasis on those types of tests, but actually a lot more on timed word reading assessments. You can't fool a timed word reading assessment. The only way that you're going to do well is if you had a good base of words that you can automatically recognize without having to decode, which is the hope. That's the hope. Words that these are words are sight words for you. There's no tricking a 30-second trial of reading as many isolated words as you can that are context free. And this is why timed word list reading is such a good tool for identifying dyslexia. Sorry, I realized I didn't talk about the FAR or a couple of the other tests in the on the previous slide. And I'll talk about them in a minute. You know, all of the oh, well, sorry, let me talk about the nonsense word. You know, you also can't fool a nonsense word reading assessment because these assessments force students to rely solely on their decoding skills, since there's no words for them to automatically recognize or even read via set for variability, because none of the words are real words. And it gets even more difficult for kids with dyslexia when you time them in their nonsense word reading. So generally, kids with dyslexia tend to perform the most poorly on timed nonsense word reading assessments. And so all of the major academic achievement batteries have untimed tests of real and nonsense word reading. And the major batteries that I'm referring to here are the Woodcock-Johnson tests of academic achievement, the Kaufman test of educational achievement, and the Wechsler individual achievement test. But not every battery has timed assessments of single word reading. My personal favorite, again, Jesse Steiff's personal favorite, not IDA or anyone else, is the Towery 2, the test of word reading efficiency. It's a 2 subtest assessment where the examinee gets 45 seconds to read as many isolated real words and nonsense words as they can. So it's really, really fast. There's a real word, a 45-second real word and a 45-second nonsense word timed. And so, for the clinicians out there, another strength is that it was co-normed with the CTOP2. So the results can be directly compared with one another. And so, as far as dyslexia assessments go, you can't beat the Towery and CTOP combo. But there are several others also that include these tasks, like the KTEA, the Wyatt, and the FAR. And someone in the chat had asked what the FAR is, and I forgot to mention that. The FAR is the Pfeiffer Assessment of Reading. It's another broad, comprehensive assessment of a ton of different reading skills. I think there's about 19 or 20 subtests on it. It's another very highly recommended great assessment of reading to give. Okay, so we also want to measure sentence and passage reading fluency. So, although dyslexia is a disorder that affects a student's ability to read words at the single word level, of course, we'd want to know how that deficit in single word reading is compounding over the course of a sentence or a passage. Fluent reading can be defined as reading with a high rate of accuracy, appropriate rate, and suitable expression or prosody. Fluent reading is not necessarily fast reading. There's no research out there that would indicate that reading at like the 90th percentile for your rate is any better than reading at the 50th percentile. In fact, reading too fast likely harms your reading comprehension. So we want to make sure that a dyslexia assessment includes a task in which the clinician listens to the examinee reading a passage aloud and is scoring them on their rate and accuracy, and then at least making some qualitative notes about expression. The assessments that do this are not exhaustive. Again, the Gray's Oral Reading Test, or the GORT 5th edition, again, the Wyatt 4, and the Pfeiffer Assessment of Reading. All of these have passage reading fluency assessments. Other assessments do have tests of reading fluency. They're often things like having the examinee read a series of a series of sentences to themselves and deciding if the sentence is true or false. And then they're scored based on the number of sentences that they've answered correctly. And this isn't necessarily a bad or a wrong proxy of fluency. It certainly is a proxy for fluency. It'll definitely pick up on students who have fluency problems. In my personal preference, though, is to listen to a child read a passage out loud and note the errors and their rate and their expression. All right. So, an assessment of reading comprehension should also be included. The measurement of reading comprehension is a tricky thing, because comprehension is like vastly more complex than any of the basic reading skills, and it can be done in a variety of different ways. Some assessments will have the student read a series of passages and answer literal and inferential questions about them, and some may be more of like a modified closed procedure where the examinee has to read a sentence and supply the word that's missing. Both of these do measure comprehension for sure, but in very different ways that we want to be aware of. My preference is for the former type of assessment because I think you get a more accurate picture of comprehension. Sometimes kids in that closed procedure where they're just supplying the word that's missing may inflate a student's actual comprehension, particularly if that student has very good language functioning. In general, though, a lot of examinees with dyslexia, particularly those with more advanced linguistic function, they may get like disproportionately high scores in reading comprehension relative to their low basic reading skills. So they're still able to glean a pretty large amount of information from text, despite not being able to read it so accurately. Many other students, particularly younger ones or kids with more severe dyslexia, may not even be able to do that because their basic reading skills are just too low. students who score low on comprehension assessments, well, it's actually students can score low on comprehension assessments because they have problems with both basic reading skills and with language and vocabulary. So you need a skilled clinician to interpret these things and really parse out the reasons for low comprehension. And for something like, and to do this, I often find it helpful to compare a student's listening comprehension with their reading comprehension. You know, so if you have a student who scored, for example, in the 60th percentile in listening comprehension as like a proxy for oral language, but maybe in the 15th percentile for reading comprehension, and they have similar score ranges in basic reading skills, it's pretty likely that their reading comprehension difficulties are because the student couldn't read accurately and fluently enough to glean that much from the text. Whereas if you have a student who is scoring in, you know, below the 20th percentile in listening comprehension and also below the 20th percentile in reading comprehension, you may have a student with a larger language, spoken language problem. You know, different profiles of student. That might not be a student with dyslexia, more would be a student with a language impairment who also has dyslexic features in basic reading skills difficulties. Right. So again, along those same lines, it's really, really important that we're not just measuring like text reading skills on a dyslexia assessment, but we're also measuring other oral language skills like spoken vocabulary, listening comprehension, and oral expression. You know, reading is a process that is deeply interconnected with oral language. You know, a lot of people will argue that one of the main points of reading instruction is teaching students how print relates to spoken language. And so students with spoken language difficulties will certainly exhibit difficulties with reading. You know, many children have reading difficulties because they exhibit difficulties in various aspects of spoken language, like understanding of syntax and oral expression and receptive language or listening comprehension, and certainly knowledge of vocabulary. You know, these are all things that will have a really drastic effect on one's ability to read and understand text. So they absolutely are necessary to include on a diagnostic battery of reading. And again, all the major test batteries have various assessments of oral language. And I would say at a minimum, we'd want measures of listening comprehension, spoken vocabulary knowledge, and oral expression. All right. So let's talk a little bit about spelling and written expression. These are almost always areas of difficulty in people with dyslexia. And so this would be a non-negotiable for me for any good literacy assessment. Spelling assessments are relatively straightforward on a diagnostic assessment. You know, you say a word and the student spells it, use it in a sentence too. Much of the time, it is really clear if the student has a severe spelling problem from like just an isolated spelling assessment. Sometimes though, we see isolated spelling performance that's a little bit better than we might have thought, given all the other data. But then when we look at writing samples, though, like the spelling is just absolutely atrocious, like compared to maybe a relative or a smaller difficulty on a spelling test. And in the next slide, I'll talk about exactly why that happens. And it has to do with working memory constraints on spelling. But for other aspects of written language, again, most test batteries will have assessments that include tasks that measure syntax and sentence construction and use of basic mechanics like punctuation and capitalization. Handwriting is like almost never included in scoring written expression tests, unfortunately, although it's like a really important aspect of writing. Handwriting difficulties, they can certainly cause problems in written expression, and it should be something that a clinician discusses in an evaluation. and certainly things that a teacher should be aware of and working on with a student who exhibits difficulties in those things. And similar to so we talked about comparing reading comprehension with listening comprehension. We also want to compare oral expression and written expression to determine if a student's writing difficulties are limited to just like transcription problems like spelling and handwriting, or if they're a function of a larger spoken language issue. And a larger spoken language issue would be indicated if there are concerns with oral expression as well as written expression. All right, so let's talk a little bit about written language skills and what types of things can be impaired in kids with dyslexia. I find this visual to be really helpful in both understanding and explaining the writing difficulties that many kids with not only dyslexia but dysgraphia also experience. And the model that we're showing here is referred to as the simple view of writing. You might be familiar with the simple view of reading, but there's a simple view of writing as well. It's very helpful. And it includes the sub-skills that are necessary for the task of writing, and illustrates kind of how those skills are interrelated. And the model includes skills that fall into 4 categories, right? So there's transcription, executive functions, working memory, and text generation. I'll talk about each one. So it's represented by this triangle, right? With each corner representing a specific writing skill. In one corner of the triangle, we have transcription skills, and that just refers to spelling and handwriting. On the other side is executive functioning skills like self-regulation, attention regulation, metacognition, your ability to think about what you're doing as you're doing it, planning, mental organization, all really important skills to that contribute to the task of writing. These 2 things, along with the student's spoken language ability, they enable text generation there at the top of the triangle. So basically, we have to use our spelling and handwriting skills as well as our executive functioning and our language skills in order to generate written language. And the center of the triangle is used to illustrate that all these skills are constrained by working memory. When more working memory resources are needed for any of these individual components of the process, fewer resources are available to manage other components of the writing process. For example, a kiddo with dyslexia may have working memory difficulties, or dysgraphia may have working memory difficulties, and also poor spelling, right? And having poor spelling skills, you need to rely more on your working memory when spelling, because spelling is not automatic, spelling is not fluent. You need to think quite a bit about how you spell a word. That leaves fewer working memory resources available for the other important tasks like generating ideas for their writing or holding those ideas in memory throughout the writing process. A classic example of working memory constraining writing is the student who has to stop what they're doing to ask the teacher or their parent how to spell a word, only to come back to their paper and totally have forgotten what they were writing about. That's transcription deficits inhibiting text generation. So you have to use more working memory to spell, so less of that is available to dedicate to other tasks. And so because all of the components of writing operate in working memory and require these considerable resources and attention, it's thought that when transcription skills are sufficiently automatic, so as kids get to be better spellers and better handwriting, more working memory space and resources are available to dedicate to your executive functioning and to your text generation. So this model also illustrates, like I said in the previous slide, why kids do better on isolated spelling tests than when they're writing connected text in terms of their spelling. So on a spelling test, all your working memory needs to do, you're dedicating 100% of your working memory just to the task of spelling. because you only have to worry about writing one word at a time, right? When you're writing a sentence or multiple sentences, you have quite a bit more to do mentally. You have to plan and organize and keep those ideas that you generated in working memory to get them down onto paper. You have to block out competing stimuli and make sure all of your working memory is dedicated to just the paper in front of you. What often suffers or what gets deprioritized mentally are those transcription skills. And so the handwriting becomes atrocious. The spelling becomes atrocious when we're writing connected text in a way that we may not see, or we may see a better, higher quality if the student just has to write one word at a time and can dedicate all their working memory resources to just handwriting or spelling. So that's just a quick little rundown of how spelling and writing and working memory all kind of work in tandem with one another. And so these are all things that a good dyslexia and writing and dysgraphia evaluation would take into account. Okay, so since dyslexia and dyscalculia travel together so often, similar to ADHD and anxiety, it really is best practice to also include measures of math in any dyslexia evaluation. We want to know about things like concepts and applications, or word problems, basically, isolated math computation, and math fluency, or how quickly a student can retrieve their basic math facts. Right? Kids with dyslexia really often struggle with things like rote memorization or fluent recall of learned information, which can really kind of throw your math fluency for a loop. On the batteries, on the diagnostic batteries, the math word problems are read aloud to the examinee. And so this is actually really helpful for a clinician in that it allows for comparison of school math if the student doesn't have an accommodation plan and they have to read, they have to read the problems by themselves, to how they do when the problem is read aloud to them, to see if math performance is being affected by their reading difficulties. But there are many kids who have math problems that are not due to their reading difficulties, and so they would have both dyscalculia and dyslexia as well. Sometimes dysgraphia as well, and they just they have a lot of difficulty. All right. What is next there? Okay, IQ. So this slide is a bit wordy, but you all will get access to these slides, and so you can read through them. So administration of an IQ test as part of a dyslexia evaluation is currently an area where there's some disagreement. IDA, the International Dyslexia Association's stance, is that an IQ test is not necessary in order to document average intelligence. Remember that dyslexia entails difficulties in reading and spelling, despite average intelligence and despite evidence-based instruction. Because there are a lot of ways that a clinician can eliminate like below average intelligence as a factor in any academic difficulty. We can do this by assessing oral language skills, as I discussed before. Oral language skills are a great proxy for general intelligence. We can examine grades or SAT scores or other academic indicators in older individuals. And so if we have scores and grades and SAT scores that are within expected ranges, we can infer that the student the person does not have a below average intelligence. Now, with that being said, there still are several reasons to administer an IQ test as part of a dyslexia evaluation. We certainly want to administer one if there's a suspicion of an intellectual disability or borderline cognitive functioning, which is cognitive functioning that's close to but just above an intellectual disability. Or on the other end of the distribution, if we think that the student may actually be gifted as well. IQ tests are also really helpful in understanding narrow cognitive abilities like processing speed, working memory. So, I mean, if we definitely want to administer an IQ test if you don't have another measure of working memory, because that is unbelievably important. Good IQ tests, most of them will measure linguistic skills that are important contributors to reading. Other cognitive abilities like long-term memory or any other numerous cognitive abilities that modern IQ tests measure. So there still is a good number of reasons to administer an IQ test. What IQ tests are not super helpful for is differentiating academic interventions for kids. So in the bottom portion of this slide references this large meta-analysis, which is like a grouping of multiple studies. And it indicated that, effective reading intervention should only really be driven by the student's individual profile of reading and related skills, not anything else. And in fact, the only cognitive area that they did show to be effective, to be an effective informer of academic intervention was phonological awareness. So differentiating interventions based on fluid reasoning or visual spatial skills or any other narrow cognitive ability doesn't yield any statistically significant advantages over just teaching the student how to read based on their reading strengths and weaknesses. All right. And I think Dr. Crooms here is going to take it away from here.
Hi, I'm back. I want to go through some of the questions before I hit on the comorbid diagnoses. Somebody had asked, why don't schools use the term dyslexia? And then another person had answered like, hey, my principal told me not to say it. That seems to happen a lot. There's a lot of like, oh, is that a niche term or a taboo term? Can we not say it? I think everybody is worried a little bit about, any kind of liability that using that term could have. So people just got into the practice of not saying it, be like, we're only going to use specific learning disability with impairment in reading. So I do think that tends to happen, and it happens in a lot of other areas, not just in the term of dyslexia, but I see it all the time, and even with other ESE categories and other diagnoses as well. So I think it's just who's in the know versus, people who've been told that, hey, don't say that word. It's a taboo thing. And another one, Nancy, I think I answered your question a little bit, but just as Jesse went over, there's a high likelihood that there will be deficits in certain areas of math and certain areas of writing that can be affected and show up in an evaluation, but that does not mean that the dysgraphia and the dyscalculia are going to be considered SLDs in reading. They're under their own under that umbrella, that specific learning disability umbrella, you still will have, math, reading, and writing. And so they're of their own right. We give them all the spotlight. Okay, so going into comorbid diagnoses with this, hitting this again, other learning disorders. Sometimes a child might just have one, sometimes they could have all, which is why, as Jesse said, it's very important to make sure that you have that comprehensive battery that's going to be looking at those areas. There is a lot of overlap. There's a lot of overlap, even in just the area of executive functioning. There's a lot of overlap. We see impairments in working memory for kids who have ADHD. That's one of the highest comorbid disorders outside of anxiety with dyslexia or the specific learning disabilities with reading, because again, you have dyslexia, and then as Jesse said, you also have areas of comprehension and things like that. But as we were talking about the areas of executive functioning, specifically working memory, when a child becomes overwhelmed, I always kind of equate it to the example of, have you ever seen those cyclists on a group ride? You start to see the tail end of the people and they're working really hard. And then all of a sudden you drive down the road, you see all the really advanced people all the way up, and like the really advanced people stop on the side, they take a break and they're all like resting. And then the last couple people come and they're like, oh, Susan's here, let's go. And Susan's like been riding the whole time trying to just catch a break. So that's essentially what's happening. So that working memory is in overdrive as kids are in the classroom. And so a lot of times they could start to present as having attention issues. They're needing more time to kind of accomplish tasks, and that happens quite often. You know, one of the good things about school evaluations is that observation that you guys do. As a private practice psychologist, I offer school components, but not all the time are parents like, yep, sign me up for that, you know? And so they kind of come through and I'll go to the school and I'll watch the child and I'll kind of be like, okay, what's going on here? I want to differentiate. Is it ADHD? Is it, you know, is it dyslexia? Is it a combination of two? And the child might have a comorbid diagnosis. For those not familiar with the term comorbid, that just means that there's two diagnoses occurring at the same time. So that's important. And having eyes on the child, which is why teachers are so crucial and important, is that sometimes we'll see anxiety also play a role. And you know, with anxiety, ADHD, and learning disorders, they all can mimic each other, and it's so wild to me because you might see a child who is resistant to reading, and all of a sudden they'll be like, I want to go to the nurse as soon as reading starts, or they start showing up late for that certain class where reading is. I had one child who they were late every day. The parent was dropping them off on time, but they were like roaming the halls because reading was the first period and they didn't want to go. And so, you know, sometimes kids, when they engage in, you know, any kind of avoidance, you know, or withdrawal in the classroom, that's a huge red flag that there might be learning deficits going on. And so again, it's really important to make sure we're looking at this child as like the whole picture, you know, because sometimes you could get bogged down looking at one area. I mean, how many times have we accidentally confused a child as having, you know, behavioral issues when actually it was a learning issue? And that was why we saw more disruptive behaviors, more off-task behaviors during certain academic subjects. So I always encourage people to kind of use those tools that we have. We have a lot of broadband screeners. We have like our BASC. A lot of even when parents bring concerns to pediatricians, they'll send out the Vanderbilt to schools. I'm sure a lot of you have gotten the Vanderbilt. I'm sure a lot of you have to fill out BASC in your spare time. I know I was just telling everybody, like, I can't imagine this school year, let alone any other school year. This school year has been really rough. And I always, when I contact teachers, I'm like, I'm so sorry. I know you are busy, but I would really appreciate it if you filled out these additional rating forms. But those socio-emotional rating forms can be very, very helpful in differentiating or even just seeing what other components to this child's day are like happening for this child. So just pretty overall important. So I want to go in and we now know the cool, awesome components of a really good assessment. Thanks to Jesse. I want to talk a little bit about yes, Jesse answered that. Good. I want to talk a little bit about the differences, because a lot of times their parents are like, well, do I go for a private evaluation? Does my school do the evaluation? What kind of goes on? And so I just wanted to touch base. Parents can seek a private evaluation at any time. You can definitely, if you have concerns, say you brought your concerns to the school and, you know, the school, you had a discussion with the school, because you can always request an evaluation from the school district as well. Say you had a discussion with the school and they looked at all their data, all those screenings, all those progress monitorings that they've been doing. They look at the child's grade, they look at work samples, and they look and they say, you know, we don't see the need for an evaluation, you know, and so they might say they're going to deny it. Now they're going to back that up with data. So that doesn't necessarily mean that they're saying no and you're like, I have to go do it anyway. You know, they're saying, hey, your child may not need this. They might come up with a compromise, which is not necessarily a compromise, but they might come up with a different route where they'll start the process for determining ESE eligibility. So this is the point where dyslexia won't be a term used at all. That will be the specific learning disability in reading eligibility. So they'll go through, in Florida, we have the MTSS, multi-tiered system of supports, which is response to intervention. And so then they'll start that process of referring kids. And so some school districts, and I've seen a variety, and I was talking with Jesse about this also, because he's still in the schools, and it varies by school district to school district, and it can even vary by school to school within a school district. So sometimes, usually when we have like a well-oiled machine with our universal screeners, our schools monitoring child performance, and we start to see these kids get picked up and referred to that MTSS team. And then we have teachers who are the eyes in the classroom, They start to notice trends in their student data and their work samples, and then the teachers will refer. And then you have parents. I know a lot of parents this year with the virtual learning started calling, and I've had more evaluations for learning disabilities and ADHD than ever because the parents are like, I've never seen this before. My child is struggling so much. And again, going back to those exclusionary principles, those are all really important because this year is kind of, like I said, it's its own special hot mess. But overall, we want to catch these kids. We want to grab these kids either way. But with private evaluations, it's typically done in like one session for an intake, potentially. Then the testing appointment might be broken up into a few. But though even the testing appointment, if it's broken up to a few sessions, they're getting a snapshot in time, which is why it's so important, as Jesse said, when you're collecting that background information, to get those work samples, to get, the progress monitoring data, as much as you can. For a student, so that you're equipped with that information for a private eval, because it's just as important. And then no matter private versus public evaluation, when you're giving these assessments to the child, you're grabbing the best testing observations possible. Like, you're looking at this child, you're overwhelming their executive functioning, you're overwhelming their working memory, you're kind of putting them through the ringer as you're checking all these areas. You can see how the child responds. You could see all these other areas that might be, a weakness for this child. So either way, they're both equally important because you're getting a lot of data for this child. Going into talking a little bit more about the RTI process, I always tell parents who are unsure. They're like, well, they're going to start the MTSS process. They're like, they're going to put my child in tier 2. Tier 2 is that small group instruction. And I said, that's great. And I always say, I was like, that is like fantastic. I was like, because they're doing intervention with your child. I was like, if you're concerned, this will be an opportunity to have some data being collected while there's actual, empirical interventions being presented to your child, to see if that'll close the gap for them, if they will respond to it, if they will progress. I mean, obviously what we know is that children who have dyslexia will honestly respond a lot slower, but the idea of response to intervention is responding. If they're responding, schools are more likely to kind of continue that route, and they'll monitor the amount of time, and then they'll push the child to tier 3 if they feel like, okay, since that took this amount of time to get them from this level to this level, we're going to intensify it with that tier 3 and see if they respond a little bit faster. And that's how they qualify a child for exceptional student education under the SLD, specific learning disability in reading. Now, I just want to make a point. It's not on these slides, but I know that there are parents out there who sometimes they'll come and they'll say, well, I don't agree with these evaluation results, and then they can request an independent educational evaluation, and that's also an option. Again, that's constant communication with the school system, and so that's going to be important. And then you have schools that get private evals that you're looking at the recommendation where it's like IEP for the child. And the school's like, we can't do that just yet. We have to do our process. And so a lot of times I've seen schools with, like I said, those well-oiled machines where they qualify a child based on intervention data. I've seen schools where they'll do all tier 2, tier 3, and then they'll do an evaluation on top of that, and then qualify or not qualify a child. So it really, like I said, there's a lot of variability. So it's hard to go into the nitty gritty differences, but overall, these are the main differences between a public versus a private evaluation. Now, with treatment considerations. So if the child is found, to have dyslexia, to have that impairment present, to have those gaps that we want to, address and intervene with, a lot of times what we'll see are the first line of defense are the accommodations. We see extended time. Again, that's to kind of help with that extra time that it takes them to kind of get through. We see the use of graphic organizers. These are to help, especially with that text generation, the ideation, and like really helping them to stay on path. I know you've seen those students that have like 1 or 2 great ideas that are like repeated over and over and over again through like the same couple paragraphs, and you're like, okay, it's a little redundant. But those can really help. Oral instructions, access to audiobooks, assistive technologies. A lot of times I've seen a lot of kids utilize typing if they're having issues with if writing and things like that. And then we have the individualized education plan. So the individualized education plan will have goals. It'll be a specialized instruction by a trained teacher. They reevaluate these yearly to make sure the child's meeting their goals and the accommodations are within that IEP. Private schools are a little bit different. Private schools are different and they vary. And a lot of times I've had parents say, oh, I've been told that because my child has a diagnosis, they're not a good fit for the school, or the school doesn't have the resources for the child. And then we see some private schools who just explode with resources for kids who have, impairments in learning, and they'll create learning centers, they'll have tutoring going on, they'll have in-house intervention and assessment happening. And, a lot of times it just varies by private school. And then we have the commercialized programs. There's a lot of them out there. There's, parents always ask, well, like, which one is the good one? Which one should we do? Which one's going to have the most bang for the buck? And obviously we want research-backed programs. We don't want, interventionists or teachers, cherry picking components from different, manualized curriculums and saying, okay, well, I like this part, but I don't like this part, because, the whole curriculum is what the research is based off of and it being implemented as such. And then again, if there are any comorbid occurring diagnoses. So I have a child who I recently evaluated who had high anxiety, which led to a lot of avoidance. That was that child who would wander the halls in the morning and not go into class. So we did some recommendations where the teacher would pull them aside to do oral reading fluency versus anytime the class was reading out loud. So that way they didn't have to read in front of their classmates. But that doesn't mean that we don't want them reading and for the teacher to hear them read. So we came up with that modification for that student. So that's going to be important. And then if there are any behavioral things going on, we obviously want recommendations for those, whether it be like a behavior intervention plan or something in place to support those students, again, just to kind of level the playing field in the classroom. And now I'm going to turn it back over to Jesse and I'll look at the questions real quick.
All right. When I took myself off mute before I even started. So there we go. We're learning. So, all right, we have lots of teachers and other non-psychologists here in the audience. So we wanted to highlight some effective assessment tools that can be used in the classroom. And the first here are Dibbles and Acadians, which many of you may be familiar with already, but they are two free downloadable sources of curriculum-based assessments that do measure key reading skills associated with dyslexia. These are generally 1-minute assessments that can be used as screenings to find which students are at risk for reading difficulties, and can also be used as repeated progress monitoring tools to measure whether or not a student is making growth in intervention. These measures are particularly powerful because they provide benchmark scores or expectations for fall, winter, and spring of each grade level for each type of assessment, so that you can compare your students' performance to other kids in the same grade to determine if they are at risk or not. And these things are all tied to a measure of risk, in that they are able to predict whether a student is on track to be meeting some end of year expectations. So when they create Dibbles and when they created Dibbles and Acadians, they gave these assessments to tens of thousands of kids, and then they give them all an end of year outcome measure, like an FSA or like a number of other states' FSA versions. And they say, well, given your performance throughout the year, we can tell if you have these scores throughout the year, you are at X percentage of risk for failing this end of year measure. And so they are really, really, really powerful tools in terms of their predictive validity. They are very good at predicting which students need intervention in reading skills because they are at risk for failure. And they include measures of lots of different reading skills, including phonological awareness and letter knowledge for kindergarten and first grade, as well as word decoding and passage reading fluency for the grades that we've indicated here in the slides. You know, I'll go into for a second here. Phoneme segmentation, the student just has 1 minute to segment a series of words into their component phonemes. And in letter naming fluency, for example, the student has 1 minute to name as many letters as they possibly can, which is an extremely powerful and predictive assessment for overall reading skill. Nonsense word fluency, again, as I talked everyone's ear off, I'm sure, about timed nonsense word decoding lists. This is the curriculum-based classroom version of those things. Nonsense word fluency is a really great overall screening for characteristics of dyslexia. You know, as I said earlier, a student's ability to rapidly decode those unfamiliar words is a really key predictor of whether they're becoming a skilled reader. And both Dibbles and Acadians provide benchmark probes and scores for grades K through 3 in nonsense word reading fluency, which is just really fantastic. And then, of course, you know, another tried and true, just rock solid indicator of risk for developing or worsening dyslexia is a student's passage reading fluency. There's really no substitute. I mean, it's just one of the best indicators of how a student is reading. If you said you have 1 minute to say whether or not you are concerned about a student, I would say, give me a passage reading fluency from Dibbles or Acadians. Then our next one, so we also wanted to highlight some other curriculum-based criterion referenced diagnostic measures for use in the classroom. So I use these measures all the time in my public school capacity, say when students are found to be at risk through a screener or through their computer adaptive assessment, and I will come in and I want to find what areas are weak in reading and where we can target intervention. And so I will use a combination of several of these things. And I do want to note here that we don't have any financial relationship with any of these providers. You know, I'm just a fan of their assessment tools. And the first is a series of assessments from a book called Core Assessing Reading Multiple Measures. Now this one is not free. You do have to buy the book, though I think several school districts have put the Core Phonics survey online. But this resource, provides these diagnostic criterion referenced assessments for all the areas of reading that you'd want to know about your students. There are, phoneme segmentation and deletion assessments. There's a phonics survey, which I use it on a weekly basis, actually, in my practice, and it follows a great progression of simple to complex decoding skills, and starts with letter and sound identification, to short vowel sounds in CVC words, to short vowels in words with digraphs and consonant blends, R-controlled invariant vowels, and then multi-syllable word decoding. I might be missing a couple there. But there are also measures of vocabulary and passage reading fluency, and Maze is a measure of fluency and comprehension. So I really highly recommend that book. Core is just a really good organization that also provides professional development. They have a lot of free online videos, a lot of which have to do with. Oh yeah, there's Judy showing her Core. That's what the book looks like. It's fantastic. They also have a book that's it's called the Core Teaching Reading Source Book. It's like, if you want to know about reading from start to finish, it's about 850 pages. But boy, if you want to talk about a textbook that will teach you almost all the things that you need to know, Core has done it there. So, okay, again, no financial relationship with them, just a big fan of theirs.
Jesse, somebody had a question about some others, that one was Words Their Way.
Mm-hmm. Yeah. Words Their Way has a really nice spelling inventory that is curriculum-based measure. I didn't mention it on here on the slides, but I do also use Words Their Way. That one, you can download that free online, and I believe there's an early elementary and an upper elementary version. The error analysis.
And a primary.
Yeah, the error analysis is fantastic. It'll tell you exactly which areas that, based on the students' errors they make, do they have difficulty with variant vowels or assimilated or prefixes or suffixes or root words or any of the other number of spelling errors a student can make. So I'm big fan of Words Their Way. One other one before that. Someone did actually mention the Phonological Awareness screening test in the chat when we first started out. That is a great benchmark criterion referenced screening or diagnostic, not diagnostic in that it will diagnose dyslexia, diagnostic in that it will indicate whether or not phonological awareness difficulties are contributing to a student's reading difficulties. So definitely not a substitute for a dyslexia evaluation. Then lastly, the folks over at Really Great Reading have a ton of free downloadable diagnostics that are all of a very high quality, and they kind of range from everything from like kindergarten readiness assessments that have multiple like vocabulary and phonemic awareness all in one to advanced decoding assessments and kind of everywhere in between. And so want to leave that on this slide by saying that there's a lot of overlap between these skills that are assessed by all these assessments that we're mentioning. So don't get overwhelmed and feel like you should be doing all of these with all of your students. That's definitely not recommended. But we do want to pick and choose. Okay, next one. So we've talked about some highly recommended assessment tools, and now on to one particular one that is very much not recommended, which is the ubiquitous sort of A to Z level for a student. And I know a lot of districts are moving away from using these, which is a good thing, because these assessments are not empirically validated as screenings or progress monitoring tools or diagnostics or outcome measures. A letter level is a very subjective measure of difficulty that a curriculum publisher has assigned to a book. It is not the skill level of a child. Many of these curriculum publishers' own studies show that children are actually able to read a variety of levels, depending on their interest and their background knowledge and a lot of other factors. So it's very much not correct to say something like, Johnny reads at a level G. So that is, we want to remove that from our vocabulary. One of the largest publishers of these level systems have publicly stated on many occasions and in many outlets that a running record level has no place on a report card, and it has no place being reported to parents as a purported skill level. And lastly, and most importantly, a running record is not designed to determine which students are at risk and which students are exhibiting reading difficulties and which ones are not. They lack the acceptable psychometric properties that the assessments we discussed in previous slides do have, like reliability. Does the test yield consistent results over multiple administrations? Running records do not. Dibbles and all the other assessments do. And predictive validity, or whether or not a test is able to accurately group kids into who is and is not at risk for reading failure. Running records do not have acceptable levels of predictive validity. There's a study that showed that if you give 100 students who are at risk a running record level will identify 30% of the students who are truly at risk. So worse than a coin flip, versus something like an oral reading fluency from Dibbles or Acadians, which identifies 80 to 90% of kids who are truly at risk. So there's a lot more to say about these types of levels, but it's sort of tangentially related to the topic at hand here, so I don't want to spend too much time on it. But I am glad to answer questions at the end, though, if there are any. But yeah, I would say that there is far too much time in school. There was a question from Carol there in the chat. far too much time in school is used conducting these running records. They are just not useful as assessments of kids' reading skill. All right. So yeah, so we were kind of at the end here. I can actually pop that in the chat there, the name of that study or the link to that study. So we just have some resources here. I think there's a typo there, other IDA articles. Whoops, sorry about that. End of the year, very busy for everyone. Sometimes little things will slip through. IDA has a really good dyslexia guide for families and educators. I mean, the IDA website is just an absolute wealth of resources. But but this particular guide that we're talking about is about it's a couple of chapters, and it goes from, you know, dyslexia identification and what to look for, and then, okay, you've been identified as having dyslexia, now what, and how to support your child through their school years and applying to college if they want to do that, and a whole variety of things. And so then we've just kind of listed some of the laws and the citations that we've kind of mentioned there, and that DOE website as well, with the document about saying dyslexia in schools. And here's Dr. Crooms and my contact information. Oh, my went out a little bit here. So, you know, we want to encourage anyone to shoot us an email if you have any questions. I want to make sure that you know, so actually it might be helpful then if you'd like to see that study that I was talking about running records, just shoot me an email. I'll be glad to give you a bunch of the resources that I use to come to those conclusions. It's not there have been a number of studies that I'm basing these sorts of assertions on. But yeah. And in terms of, oh, sorry.
Oh, sorry. I was just going to say we had a couple other questions too before we wrap up.
Yeah, so I'm seeing, what about for progress monitoring? Yeah, running records, we don't want to use running records for progress monitoring again, but we want to use curriculum-based measurements like Dibbles or Acadians. There's also AIMSweb or EasyCBM or other publishers who publish similar things. Computer adaptive assessments they're kind of a tricky thing. I have many opinions about computer adaptive instruction, but as assessments go, they have high levels of reliability and validity. They are very good at predicting which students are at risk and which students are not at risk. There are, of course, measurement problems, as there are measurement problems with direct assessment in kids. Kids with ADHD or kids with executive functioning difficulties may certainly underestimate their true skill. It is very difficult, I would say, to measure phonological awareness or word decoding through a computer. But generally and so some kids on the margins may be missed. So kids who might have real decoding difficulties may be kind of marked as proficient and vice versa. But generally, large groups of statistically significant large groups of students are accurately measured with computer adaptive assessments, and they can be used as progress monitoring. But it's all in how you interpret the scores. So for example, you know, on something like iReady, you have a ton of different scores that go into an iReady diagnostic. You have measures of phonemic awareness, of phonics, of high frequency words, of text fluency, vocabulary, and comprehension. And so what schools will often do is look at that overall score. It's kind of a composite of all the different skills, and what can be problematic about that is if you have a student with dyslexia who's very strong linguistically and in terms of their comprehension and their vocabulary, and yet have relative weaknesses in their basic reading skills, that overall reading score may mask those deficiencies in basic reading skills, and they may fall in the average range. And so, you know, if someone is just looking at that overall score and they see the student is average or typical, they may say, oh, there's no problem here. But we always want to be in the business of looking at all of the pieces of data and doing those deeper dives. So that can be problematic if you're not taking a deep enough dive into the data. But in general, you know, I think computer adaptive assessments are not going anywhere for sure. They will be with us. They are the way that that the country is moving, and Florida just passed HB 7011, which mandates by 2022, 2023, every kid in K-8 will be progress monitored with a computer adaptive assessment. Let's see here, other questions. Do I have any resources that refute the use of MAP scores for determining which children receive RTI? I don't, nor would I necessarily want, you know, again, I think the difficulties inherent to MAP are similar to what you see in iStation. It's really an all in how you interpret the data. MAP also, I mean, they have K2 and then they have your K1 and you have your 2-5, and in something like the 2nd through 5th grade MAP assessment, it's primarily an outcome measure. It measures mostly like comprehension and you know, and higher level reading skills and doesn't necessarily is not a specific measure of basic reading skills like we would be concerned here with kids with dyslexia. So you might have kids with dyslexia with a real learning disability who are coming out average or above on MAP. And so, you know, if you have a concern, you as a parent or as a teacher, we want to do some deeper dives. We want to administer some diagnostic assessments to those students if we have those concerns, you know, to see what's going on. So I would say we don't want to use only MAP to determine as the sole indicator of which students are placed in Tier 2 and Tier 3 intervention. But as for specific studies, no, I'm not aware.
Okay. So I think that's all the questions, and Judy has a good announcement. Join us on June 12th at 11 for our next web series. It's all about oral language and building the brain for literacy. So I know Jesse does too, that you guys spent some time with us this weekend and going through the components of a dyslexia assessment.
And I want to thank Colleen and Jesse very, very much for your time, expertise, talents, and all that wonderful, wonderful information that you shared. I'm sure all our participants are grateful. And I also want to thank all our participants for your time joining us today on a Saturday before Mother's Day. So again, I put in the chat the information about our third Lunch and Learn webinar with Jan Wasilewicz. And I want to just wish all the teachers and educators out there a happy Teacher Appreciation Week, which we just celebrated. And I know this has been a very, very special, challenging school year. So again, thank you to all of you out there who are doing your best to get to all our students. And I always have to end with a little poem or something about reading and literacy. And because I have an audience, I'm just sharing again this book that I love, 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 A New Alphabet for Humanity. And if you don't have it, if you just go to alphabetforhumanity.com, it's very economical. It's an ABC book, but it's all about social, emotional, and just how we will want all our students to live in this world. And I want to share a little poem that came from them, and it's called Our Children Are the Future. We teach our children every day that being grateful is the way. We live from our hearts and show our love for ourselves, the earth, and the sky above. Our children know how much they are loved and how much we support things they dream of. We commit to empathy and compassion to show our children love in action. We live each day with peace of mind while we teach our children to be generous and kind. We show our children we can all work together to heal the earth and make it better. We're holding space for a future that's bright and encourage our children to shine their light. We're changing the world by changing our ways, and the legacy we leave will be brighter days for our children, for their children, and future generations. So again, I want to wish all the moms and grandmas and aunts and everybody who works as a mom, all our teachers, school psychologists, speech pathologists, and everybody out there who influence our children, not just in Florida, but beyond. So again, thank you. Have a wonderful weekend. If you have any questions, feel free to contact us, and we hope we see all of you next month. So thanks again, everybody. Bye.
Thank you so much.
Bye-bye.